Scientists from Nanyang Technological University have developed a chip that can tell if a person has a healthy immune system within minutes using just a drop of blood. Now, it's dubbed a lab-on-a-chip, and it could help doctors spot early signs of inflammation and infection in patients in the future.
Assistant Professors Ho-Han Wei and Holden Lee are here in studio to tell us more. Professors, thanks very much for joining us.
Yes.
First of all, tell us a bit more about how this chip works exactly, Holden.
Yes. Maybe Han Wei can start with it.
Okay. So this chip is a microfluidic device which allows us to analyze a patient's immune health quickly and with using a drop of blood. So what it does is when we will first inject blood into the device, and in the first stage of this chip, it will separate out the white blood cells, or known as the immune cells, from other red components. And then these white blood cells, they are channeled into the second stage where we do the electrical measurements. So based on these electrical properties, we can then understand more about the cell inflammation state as well as their functional changes, which are then indicative of a person's immune health.
So right now, if you want to check on your immune level, you know, how healthy your immune system is, and your doctor takes a blood test, they can tell, you know, what what certain proteins you have, your immunoglobulin and so on. So how does this chip differ from the test that we already have?
Yes. So like you say, in hospital and clinic nowadays, we will measure the immune cell count by optical imaging. If we want to do further in-depth study of these immune cells, look at their functional or inflammation changes, we have to isolate these cells in lab settings, which will usually take several hours, and then we have to perform specific tests in labs to understand their inflammation risk. So this chip, in a way, helps to streamline all of this process into a miniaturized form, and this will reduce time and cost, as well as give doctors more information on the immune cell system, including the immune cell activation level as well as the cell count.
So we are able to detect early signs of inflammation and infection. In so doing, what kind of conditions would this little contraption be the most useful in detecting?
So right now we have developed this chip to look at the immune status in health and diseases. Our focus is on diabetes for now. So as we all know, glucose meter is often used to measure the blood sugar level in our body, but glucose measurement alone is not enough to give a complete picture of the diabetes condition. So you can imagine that in a diabetes patient, under constant exposure to high glucose and high cholesterol, the immune cells themselves actually get activated. And so it is thus very important to understand what is the implication of this inflammation risk, and that can contribute to the different kinds of diabetes-related complications.
Yes. Well, our immune system is also very relevant and important for illnesses like cancer as well, no doubt. So do you anticipate that there may be other applications that this chip will be useful for?
Yes, very much. In fact, we have been in discussion with several doctors locally. We are looking into areas like cancer and also in UTI, urinary tract infections. So those are some of the examples that we think that this platform, which is a common platform that can be used to study for this kind of cases.
And just to give us a bit more background, how long does it take right now before this contraption is used in order to sort of get a true sense of an immune system?
Okay, so the time frame we have set ourselves is for about 2 to 3 years' time. So currently we are pursuing this research in 2 directions. One is on the clinical study and one is on the engineering aim. So for the clinical part, we are collaborating with Tan Tock Seng Hospital to test this chip using patient sample with diabetes of different severity. So we're going to use this chip to test immune cells from healthy individuals, pre-diabetes, and diabetic patients, as well as diabetic patients who have developed cardiovascular complications. So in this way, we were able to find out what is the actual and the key immune markers that will be responsible and can have a predictive value for the doctors in future.
And again, just to get a bit more of the understanding of the existing process right now, how long does it take currently to tell if a person has a healthy immune system or not? What kind of the testing that has to go through, that has to take place? How long does that take?
Yes, in the clinical, probably you will be asked to draw blood through a test tube. Probably there's about 10 ml, those kind of size. Also, imagine that you just only have 1 drop of blood, which is say only 1 part of 200, you know, of a 10 ml test tube. They can use that to test your immune system in less than say a few minutes. So I think that this one, in terms of cost saving, in terms of speed, is much better as compared to what we have in the laboratory setting. And also, we always envision that in a clinical setting, you may not have all the laboratory tools for you to do this kind of testing. So imagine that this thing can be commercialized in such a way that it can be a desktop, kind of like a testing kit. It can be put in clinics. It will help the doctors to make diagnostics much faster.
Is there any sense of, at the moment, the accuracy of tests?
Yes.
So this is right now we have just developed this prototype and a proof of concept in a small number of patients. So to answer your question, we're going to do a large-scale clinical validation to really find out what is the key, the sensitivity and the specificity of this assay.
All right. Thanks very much, Assistant Professors Ho as well as Lee. We've been speaking there with Assistant Professor Ho Han Wei and Assistant Professor Holden Lee from the Nanyang Technological University. Thanks very much.
Thank you.
Thank you.